Hi guys, this is Dr. Foster Diala of the Fosterlicious DIY. Do it yourself. Yes, today we are going to be talking about a topic that is cosmetic related, and the topic is tooth discoloration, stained teeth. Yes, so we are going to be talking about the causes of stain on the teeth, prevention, and the remedy. How do we remedy tooth discoloration when it must have occurred? So let's dive right into discussion. This particular problem, teeth discoloration, is very common and it varies from brownish, yellowish, blackish stains on the teeth. Some people may have it as irregular patches on the teeth, while others may have it as brownish lines, which varies in shapes and sizes on the teeth. So in today's topic, we are going to be talking about the causes of teeth stain, how to prevent it, and how to remove them when the teeth is already stained. Now, let's dive into the causes of teeth stain. Number one, some food and drinks, especially those colored ones. Most food and drinks that are dark colored, they contain chromogens. And these chromogens, they are chemicals like tannic acid found in red wine. These colored chemicals stain the tooth enamel. That is the outer part of the teeth that you can see. That is the enamel. Then let me go further and explain what chromogens are. Chromogens are particles that are capable of staining other objects, especially the tooth enamel. And when they stain the tooth enamel, they cause discoloration of the teeth. Example, coffee. Coffee has high level of chromogens. If you take coffee very often without good oral hygiene, you may have tooth staining. Your teeth may become stained. Number two, tartar formation. Tartar formation. What is tartar formation? Tartar occurs as a result of the thousands of bacteria inside the mouth, which mixes up with food particles, especially when you don't clean your mouth properly after eating. They mix up with these food particles and form sticky substances that get stuck on the teeth, on the surface of the teeth, and they form sticky plaques. So if you are among those with poor oral hygiene, these plaques would harden and form more permanent coating called tartar or calculus. And when tartar is formed, only dental professionals can remove tartar or calculus. Other conditions that can predispose someone to developing tartar aside poor oral hygiene include smoking, diabetes mellitus, bedridden or very sick individuals. Also, hormonal changes in pregnancy, puberty, and menopause can predispose one to developing tartar. Any drug that can cause reduced salivation, that makes the saliva in your mouth to be reduced, can also predispose you to developing tartar, because your saliva helps to clean your mouth naturally. Number three cause of tooth staining is the use of nicotine or tobacco. It's frequent smoking, chronic smoking, and the frequent use of tobacco products, for example, chewing cola nuts all the time, they cause sticky stains on the teeth. And then over time, these stains will become darker and harder to remove. So for smokers and tobacco users, cola nut chewers, take care because of your teeth. For the women among you, so that it wouldn't reduce your bride price or make you lose your boyfriend or your husband. For the men among you using all these things that can stain your teeth, also be careful and maintain proper oral hygiene so that it will not make you to lose some beautiful girls that you may be in love with, or make you to lose some very good quality wives or even job appointments. You may even lose job interview when you open your mouth and there is stains all over the place. They will like, shoo, for how long are we going to endure this kind of word map on this person's teeth? Number 4, tooth decay. So as we already know, our mouth naturally contains numerous bacteria, and when we don't maintain proper oral hygiene, especially when we eat a lot of sugary food and drinks and colored food and drinks, they would stick to the teeth, and this bacteria will come to feed on them, and in the process they will cause tooth discoloration, plaque formation, tartar formation, and this can also lead to tooth decay. Your teeth color will now change brownish or yellowish or darkish, like that. Some individuals, as a result of the erosion of the enamel that protects the teeth, can develop high sensitivity to cold or hot food and beverages. So they have this shocking sensation in their teeth when they consume any food that is cold or beverages that are cold or hot. Number 5 is old age. As people get older, their enamel would naturally begin to degrade, and this exposes the dentine which is underneath, and it is not white in color, it is somehow yellowish in color. As a result, this natural process of enamel degradation as a result of old age causes tooth discoloration. Number 6, genetics. Everyone's tooth color is naturally different, in that some people have whiter teeth color while others' teeth color are darker. Number 7, previous dental work. These include dental fillings, crowns, bridges, all those dental terminologies. These may eventually wear down and lose their color, and this will cause tooth discoloration. Number 8, some medications. Or some medications like antibiotics, for example, tetracycline. Other medications like benchlamide, chlorhexidine, they can also cause tooth discoloration, among others. Number 9, enamel hypoplasia. What is enamel hypoplasia? For individuals that have the enamel hypoplasia, it occurs during their development, in which there is disruption in the development of the enamel of the teeth. The enamel would look harder but actually thin. It might appear chalky, whitish or yellowish patches on the teeth. Enamel hypoplasia can also be acquired, but when this condition is present from birth, it is called amelogenesis imperfecta. The common risk factors for enamel hypoplasia include poor nutrition during pregnancy, when a pregnant woman is not feeding well, especially if a pregnant woman has low calcium levels in her blood. Prematurity and some birth injuries are also risk factors. Some viral and bacterial infections, examples include measles, chickenpox, they are risk factors too. Severe illness in a pregnant woman can also predispose to the baby having this condition. Fluorosis or ingestion of fluoride, tooth injury and damage, exposure to some toxins and allergens. Number 10 cause of tooth discoloration could be celiac disease. What is celiac disease? Patients with celiac disease, they have trouble whenever they eat any food that contains gluten, which causes them a lot of trouble in their small intestine. Yeah. So they are not able to digest any food containing gluten. Dental symptoms are the most noticeable indications of celiac disease in such patients. They have patches of white, yellowish, brownish or darkish discoloration on their teeth, and their enamel is also weak. This appears on both sides of the mouth. Number 11 cause is fluorosis. I mentioned that before, because too much fluoride can stain the enamel, especially in children less than 8 years of age. The stain of fluorosis can be whitish or grayish color across the teeth, and then when severe, it can cause dark discoloration, but in all, the condition is generally harmless.